Hello and welcome to this afternoon's webinar, which is going to be about the HDA's Quality Assured scheme. And the point today is just to tell you all about that, what it involves and the benefits of being part of that. And on the call this afternoon and leading the webinar are Helen Santini, who's our team leader for the advisory service at the HDA, and Joanna McCabe and Diana King, who are specialist Huntington's disease advisors. So I'm going to hand you over to them. Helen, if I hand over to you, is that okay?
Brilliant, thanks, John. And it's lovely to be here talking about Quality Assured, which, as John said, is our care home accreditation scheme. And we've called it, it's all about quality, confidence in care with HD Quality Assured, because I think, obviously, hopefully we'll, over this webinar will give you lots of information about what the scheme involves if you're interested in taking part, thinking about it, or have signed up for the scheme. But also I think there's some really important messages all the way through, really, wherever you're coming from in terms of care with Huntington's, because what we do is pick out some of the really key parts of providing specialist care for people with Huntington's. And I think that there can be learning points kind of throughout in terms of thinking how we can really offer good quality care for people with Huntington's. So what we'll do is I'll just give a little bit of background to the scheme and some of the reasons why the scheme's important. And then I'll hand over to Diana and Joe just to talk through the process and the sort of the practicalities of what's involved and the different standards that we look at. So the scheme grew a few years ago out of really a desire to offer specialist, some advice on specialist care to families and confidence in choosing care homes for people with Huntington's disease and their families. It started with a project which identified a core set of standards which were seen as key for specialist care in Huntington's disease. Back in 2019, 2 pilot nursing homes went through the scheme and were accredited. But obviously then what happened is COVID hit, the world changed, and for a time things were very difficult in care homes, and also, you know, things were operating differently for the Huntington's Disease Association as well. So the scheme was paused, but since then it has restarted, and we have in the last couple of years accredited 7 care homes, or re-accredited in some cases. But as well as that, we've got various other homes in the process of applying, so they're at various stages in that process. So it is a growing scheme, and we hope that it will grow further, because obviously the more care homes that we have in the scheme, the better the resource for families and for care homes as well. So what I wanted to do is give a bit of an idea of why people take part in Quality Assured. I mean, I mentioned that it rose out of that desire to offer more information and support for families in terms of choosing care homes. But I think what has also been really lovely is seeing some of the benefits that the care homes have identified as well. So these are some quotes that have come from care homes. Obviously, just a little bit of a caveat. Obviously it's not huge numbers that have been through the process so far, but just a bit of a flavour of kind of what those care homes have said. So we enjoyed the process, and as a team are very proud of the achievement. And as I said, I think what's been really lovely is seeing how much it means to the care homes and the team as well, because we know that providing good quality care takes a lot of hard work. It takes a real team effort, and it involves everyone at the care home. And so I think rightly so, teams are very proud of becoming Quality Assured and becoming accredited. We care for people living with Huntington's, and we want to provide specialist care to enhance the lives of these people and to broaden staff knowledge. So again, I think another key point is around raising the standards of care as well, and that staff knowledge. And staff knowledge, as Diana and Joe will show you, kind of really comes across in all of the standards, and is a really key area. We look after a number of residents with Huntington's within our home, We're very passionate about giving good care and wanted to give the amazing staff something to be proud of, and that family looking for a replacement feel we understand their loved one's needs. So yes, it is around that confidence for families, which we've mentioned, but really recognising that passion and again the sort of the pride for staff who are working very hard to provide care. So just some of the reasons. So obviously assurance for families, improving the quality of care. So I think improving quality of care is always an ongoing piece of work. It's something that we always, to offer good quality care, you need to be constantly reflecting on and constantly looking for that kind of next area to develop. There's always something that can be learned from and something that can be improved. So it's very much part of the scheme. But at the same time, recognition of that work, effort and dedication to providing good care. It does help build better links with the Huntington's Disease Association and offering support from our advisory service. So many of the care homes that go through the scheme will already have will have strong links with their local advisor, but obviously through the process have close links with Diana, with Joe, with other members of the team, which I think just enriches and supports those links between the HDA and the care home. The promotion of their services, so obviously that recognition that it is a care home that's accredited to provide providing care for people with Huntington's disease, and evidence and justification to commissioners as a specialist provider as well. And these are just following on from that, just a few snapshots of some of the media attention that some of the care homes getting accredited have had. We always try and do a little sort of article around when a care home becomes accredited, and that's sometimes been picked up elsewhere as well. So I'll now hand over to Diana and Joe just to talk through a bit about the process.
Okay, I think it's me. The process involves various different aspects, but initially you need to have a minimum of a good CQC or CIW rating in Wales, and many of the homes have got good and well above, but you need to have good for the whole duration of your accreditation process. If you make initial contact with us, we then send you out the paperwork, including the terms and conditions. And the fee currently is £4,000 for 2 years accreditation, and that's the total cost, unless you need any additional visits, which hopefully you won't need. We've got currently 9 standards to meet. We have currently been reviewing these, so there will be a further one around end of life issues, but it's a similar amount of evidence. It's not a further large amount of evidence to add. And this portfolio has to be achieved over 6 months, and we will support you and help you as much as you like within reason over that 6 months. At the end of that 6 months, we come and do a visit and spend a couple of days with you. People are often very worried about these visits, but we do try to be nice and friendly, and we want you to pass and to achieve accreditation if you deserve to. So it's not something to be as scared about as people sometimes are. And one of the things we ask is that you display a notice of intention to apply and give out questionnaires to families and stakeholders and things. So this is just to get a big picture of how things are. So we then complete a report and we put this report to a panel and they decide whether it meets the standards or not. And from that, they decide whether the home is accredited or not.
So over to me now, I think. So the first standard we'll look at is your governance. So we'll look at your CQC or CIW reports. We generally give the managers a questionnaire to fill in to find out your knowledge about Huntington's. And we'll look at things such as your complaints, compliments, policies, what information you've got around the home. We'll have a look at any accidents or incident forms relating to residents as well. And what we'll be wanting to look at is things like what you've done about them, how you've sort of talked to staff about it, what procedures you've got in place for managing these. We'll ask you about your staffing levels and things. We'll have a look at your handover documentation. And if you use any agency staff, we'll ask you how you manage those, how you can ensure that they know what they're doing, and that sort of thing. That's the first sort of standard. It's a little bit more in depth than that, but that's a basic overview of it and what we'll be looking for. Next slide.
The second standard is around staff and their knowledge and their support, that they have appropriate training and that they actually understand HD. So we do some bits around what training and what support do they have, what levels of supervisions, what additional support, and this is over and above what a home would generally provide. And how do they deal with challenging behaviour? How do they deal with the specific care needs of those people with Huntington's? How do they understand best interest, capacity? And we're both we've both had a working history in nursing homes. We're realistic. We're not expecting you to be perfect all the time, but it's how do you deal with when things are not always that easy. It's not expecting perfection all the time. Next slide.
Then we'll look at all your policies and things around nutrition and hydration, how you train your staff, which staff are trained. So we'll also talk to your catering staff. We like to have a look at the meals you're providing to see what they look like. We'll talk to you about pegs and that sort of thing to see how if staff are trained in that side of things as well. We'll look at whether you're flexible where people can eat and when they can eat, and if food's available at other times. If residents are supervised when they're eating, we'll look at sort of your monitoring procedures as well, fluid and food charts, just briefly, not in great depth and things. And we'll also look at whether you've involved like speech and language therapists and have a look at their sort of updates and reports on residents as well. We've got about future care needs in here. Like Diana said, we are looking to possibly do another standard on the end as well, but we will look at whether you've had discussions with residents about pegs in the future, and that sort of thing as well. And also obviously oral hygiene is quite important, so we'll look at how you manage oral hygiene with your residents with HD as well.
So a big area of what we look at is how you manage behaviour and cognition issues, and how you discuss care planning and what understanding you have of behavioural changes and assessment techniques, and what MDT do you have access to, and do you have do you tend to refer people appropriately, and do you have appropriate specialists that you can refer to? How do you manage perseverative behaviours, which are a common issue within the care of those with HD? But again, we know that things happen, and it's how do you manage them, and how do you minimise the risks, and how are your policies around doing things, rather than we don't expect everything to be in the green zone all the time. So it's about how do you understand it and how do you manage things.
So the next standard we look at about is your sort of interaction with other professionals. So we'll ask you for evidence, basically, of working with others, MDT team, with consultants, speech and language therapists, dietitians, OTs. We'll look at care plans to see how you've worked with them and to see what input they've had.
So for Huntington's particularly, an understanding of genetics and the impact on the family is a really big thing for us, and can have a huge impact on the family if you don't have this understanding. So this is this standard is quite an important one to us. So we will be asking the carers and the staff for a basic understanding of genetics. We're not expecting them to know everything that everybody ever knew about genetics. It's just the basics, or what to do if they don't know, and to know what the basic impact is on the family unit, and what is done about communicating with family and seeking their views, and how families are involved, because not all families are straightforward, but also how if there isn't family or friends available, how you deal with advocacy and other such people. So it's about how do you support that side of the person's care.
The next thing we'll look at is what specialist equipment you use. So when we come to visit you, we'll have a look around the home and see what equipment you've got in use. We'll talk to you about how you manage to get equipment, if you have any issues getting it, what happens if somebody needs some equipment and their funder won't provide it. And we'll talk to you about who does the assessments for equipment, risk assessments around it as well, and whether it's actually suitable for the person who's using it. So if you've got physios and people, we'll talk to them while we're on site and things as well. Sorry, carry on.
And standard 8 is communication. So it's about all the different aspects of communication, because again, very important that people can communicate to their maximum. So, you know, are people able to be regularly assessed? Do we involve the MDT? It's the last one. Stuff about doing life story works involving family and friends. What communication aids have you got? What things do you do to make sure that people are communicated with as much as possible? Anything that you do that's a bit different as well, and new practices that you've found that work. We're always keen to see new ideas.
Last but not least is social stimulation. So we're very keen to see all the lovely activities you get up to. We like to see photographs around. We like to see, you know, if you've got something on when we come, that's really lovely. We like to see that as well. And staff getting involved and enjoying themselves as well. So this is all about quality of life, really. So we need to see evidence that you're giving people as good a quality of life as they can have. And obviously taking their personal choices into account as well, and hopefully managing some individual activities as well as group ones. So lots of photos and things like that are great to see.
So it's quite a complex process, but it's once you get into it, it's quite easy to follow, says me, who has to look through your files. But if you'll get sent all the information, you just need to go through the file and find a bit of evidence to show each one. We appreciate that as time's moved on, sometimes the evidence is a little bit difficult to send electronically to us, which is what we need you to do. So there are things that you can't send us, then we will see it when we come to do the visit. That's fine. You won't get penalised for that. So it's make sure you read all the information, set it out into your portfolio, into each section before you start, and make sure that the whole team are fully involved and informed prior to starting the process, and ensure the team understand what's required of them, and holding regular progress meetings, setting a realistic deadline to prepare the submission. This is what a lot of people have said, that this is how they've gone about it. And do it, and make sure you ask for help if you need it. We're here, we're quite happy to talk to you. And short of coming and doing your portfolio for you or shifts, we're not that keen on shifts, are we, Joe? So we're quite happy to help you as much as we can, because we want to increase and improve care as well. So to make sure you ask for help if you need it, and that you have a good understanding of the condition and how to support people with Huntington's. as I say, we are reviewing the standards a little bit, so they may well change a little bit from how we've just described them, but that's basically along the lines that they're going to be. So why, is it me?
You can carry on, that's fine.
Right, okay. So why would you be part of Quality Assured? Well, 100%, which you can't get better than that, felt that they had information about the scheme, and no one reported any difficulties completing the process. 100% felt that they'd improved knowledge and understanding of Huntington's in their team. They also felt that they'd improved the care of people with Huntington's, and they felt that it had benefited their care home. So basically, everybody wins, really. Everybody benefits from the scheme, and it seems to have all the homes that we've visited have really been very positive about it, and it's been a really positive experience for us as well. We've learned so much from going to all the different homes and seeing all the different ways of doing things, and all the variety of different levels of care home as well, where from at all different costs, all different intensities. So it's good to give it a go, and we're certainly happy to support you to do it.
So obviously we're around, so any questions you can email ourselves. If you wanted any more information, the email's there for our info site, and they will send you a pack out. But if you wanted to talk to somebody, just get hold of our helpline, and they'll get hold of Diana or Helen or myself, and we can always give you a ring and talk through anything else you want to know. There is some more information on our website as well.
Yeah, so that's just the contact details if there is, if you do have questions. Obviously, Joe and Diana have just given a very basic overview of what the scheme is, but if you have more detailed questions, or if you come off the call and start to wonder about something in more particularly, then please get in touch and we'll answer those questions for you. All that remains to say is to say thank you very much to Helen and Diana and Joe for doing the presentation today, and to yourselves for coming along. Hope you found it interesting, and hope you consider maybe participation in the scheme in the future. So thanks very much, and enjoy the rest of your afternoon.